Hi, this is Dr. David Zahalik, and I have part two for you on the update on strep, sinusitis, and influenza. Um, so let's just get started. Talking about sinusitis, this is more addressing treatment rather than the diagnosis and the symptoms. So, starting with sinusitis, I just want to remind everybody that in the first 7 to 10 days of a sinus infection, most of the germs are viral. And so, if the airways stay open and the sinuses ventilate and drain, then the body will usually kill the viral infection, and that's the end of it. So, in the first 7 to 10 days of sinus type symptoms, often we're addressing the obstruction or the blockage first and holding back on antibiotics. So, we use things like antihistamines and decongestants, drying agents. One of them is methscopolamine. The brand name for that is Pamine, to kind of get some of the swelling out of there. Steroids, either a steroid nasal spray or an oral cortisone pack or a steroid shot. And then we also use nasal rinses, things like the neti pot, or they sell over-the-counter Ensol or Neilmed rinse. And these things will help to not only clean it out, but decrease some of the swelling in there as well. And then, if it's still not getting better or it has clear signs of being bacterial, then we should come in there with our antibiotics. One of the pitfalls to antibiotic treatment of sinusitis is it's a deeper tissue, so for the drug to get back there, it takes longer. So typically we're going to do 10, 14, or even 21 days of treatment to get the drug to the site where it needs to go. And we try to not change antibiotics frequently in the treatment of sinusitis. So if one time you take Cipro and then you take Avelox and then you take Omnicef, it's a great way to create antibiotic resistance. So what I try and do is I try and stay with what worked last and ride that until it stops working. So drugs like amoxicillin is still, as good as any of the others, quite honestly, as long as you take it for the full duration. Or cephalosporin drugs like Ceftin, etc. Doxycycline is a good one. Of course, some people it causes some GI upset. Cipro also not bad for sinusitis. But again, we want to make sure that we're consistent with completing the course and trying to stay away from the broad spectrum antibiotics to decrease resistance. And one thing I'll mention is Z-Pak, which a lot of people will ask for by name, has a 20% local failure rate in sinusitis treatment. Mainly it's because Z-Pak, you only take it for 5 days and it works for about 10 days, and it doesn't do a good job of penetrating deeply into those sinuses. So often people who take a Z-Pak end up taking a second Z-Pak. Maybe it's not the best drug for sinusitis, but of course we look at every patient individually. Strep is pretty straightforward. It's a bacterial infection, so it needs regular antibacterial antibiotics, usually penicillins, like amoxicillin. If somebody has an abscess associated with their strep, you'll see a much larger tonsil that perhaps has pus on it, bright red, crowding the airway. Sometimes they're drooling because they can't clear their secretions. Those also require usually a drainage procedure to drain the pus out of that tonsil, often steroids and then saline rinses to help there. But strep is basically use antibiotics and clear out the infection and monitor to make sure there's no complications from it. And then influenza is one of the few viral infections that we actually have antiviral antibiotics for. Things like Flumidine, which is an older drug, or Tamiflu, or Relenza, which is a nasal spray. Flumidine and Tamiflu are tablets. Most of the viral infections that cause colds and upper respiratory infections, there is no specific antibiotic for. So this is a virus that we can actually treat. And it's also useful to know that the treatment is only considered effective within the first 72 hours of the onset of symptoms. So if you're diagnosed with the flu, but your symptoms were 4 days ago, you're just going to have to wait it out without antibiotics. And then it's also important when you're treating influenza to monitor for signs of complications, mainly pneumonia, make sure there's no pneumonia in there, or if there's any cardiac or respiratory conditions, make sure there isn't a tipping over into heart failure or worsening of COPD or any underlying lung problems. So not to make you all into doctors, but just so you kind of know a little bit around the background of how we treat these things. Hopefully this is of use to you, and stay well during the flu season. Bye-bye.